next question will be, in your opinion, which is the most concerning issue faced by the medical industry today?
In India.
Yeah.
Uh, See, if you talk about the health sector in India, I would like to sum up it in, for me, uh, as a stakeholder of this industry, we people who are staying in Mumbai, it doesn't make much of a difference. But because we are blessed with a good health infrastructure in this city. But when we talk about the country as a whole, the scene is different. It's an entirely different scenario. You can say, like, the first major concern I feel in today's health industry is awareness lack. The first A that I would say, there is the people of India are basically a lot of lack of awareness in the people about their own health. Now, when I talk about health, when we go to the WHO definition of health, it says that it's a complete mental, social, physical well being of an individual and not merely an absence of disease or infirmity. That's important. So, the awareness of the people about health, or the definition that the people have in mind about health, is totally different when we talk about Indian people basically. So that has to change. This awareness has to increase more. The second thing that I feel, especially in a country like India, is the accessibility issues. As I previously mentioned, in Mumbai you won't find this difference. But as you go to the interiors of any state, be it Maharashtra or any state of the country, we are having accessibility issues. uh, Tertiary healthcare my is not accessible to each and every person out here in the country. So this accessibility issue has to be tackled with, at least for few 100 kilometers. There should be a proper health facility which should be available for each and every person out there. A health facility which is well equipped, at least for the life saving issues that a person faces. So that is one issue I personally feel which really needs to be dealt with. The third A that I feel in this will be the affordability issues. The healthcare which is available in the other parts of the country makes us shell a lot of amount of money, which might not be possible for each and everybody of us. So basically, the health facility which is being provided to the government, by the government to each and every common person in the country, should be at an affordable cost and should be of a quality. It should be a quality healthcare at an affordable cost. So this accessibility, awareness lack, and affordability are the three major concerns I feel that our Indian healthcare industry is facing. And last but not the least, somewhere the concept of brain drain applies to the health industries as well. If you talk about me as well, or my colleagues, there are many doctors who, after completing their MBBS or their post graduation, feel that going to other foreign countries is more welcome than staying in their own country, because somewhere the available options are pretty less in our country, or uh, many issues, say debts in even liability issues or safety of the doctors, each and everything of these somewhere force a person to feel secure more outside in a foreign country than being in their own country. And this brain drain somewhere is of concern to our country now. So we need to secure our doctors. We need to give them incentives. We need to give them whatever they deserve. They have invested 30, 35 years of their lives in studying so hard. They have uh, they have invested their major chunk of their life in this. So it's the responsibility of our government to take care of them, to make them various opportunities available, uh, to give them justice to whatever they have achieved till now. So that is in the hands of the government. So if these small things are looked upon, I think our healthcare industry would be in a better shape.
Okay. So my next question is, as we know, many foreign countries have adopted the science of Ayurveda and Yoga. So why is our country giving least priority to it?
Yeah, a pretty good question, dear. I would like to differ from this a bit now because uh, I would have accepted this if it would have been a fair few years back. But now, our government, after the setup of the Ayush industry, which is a common commandment of Ayurveda, Unani, Yoga, Siddha, and homeopathy, somewhere now we ourselves have started respecting our culture, I feel. So the recognition that this therapies or this alternative medicines have acquired in the foreign countries is not so much in India, because somewhere we are tending to forget what we are actually having. There are few illnesses, I won't say few illnesses, many of them, which are far beyond our understanding of our allopathy sciences also. So these illnesses, when we reach to the basic genesis of those illnesses, somewhere we find that yes, the remedy for them lies with our own ancient Ayurveda or homeopathy. So we need to improvise. Our government needs to prioritize this now, and somewhere they are taking steps for the same. Now, with the All India Institute of Allied Sciences coming up in New Delhi, this is going to be a real boost for the allied sciences. Along with that, now, especially in the COVID 19 times, when various injections or various therapies that we were using, the immunomodulated drugs which were using for COVID, uh, which were not of proven significance but were still being used. Along with that, there were many alternative therapy medicines which were used at the same time. So, COVID 19 has really given a boost to this alternative medicines, and somewhere I don't think so that it will be a long time from now that yes, these practices will be making a comeback in our lives as well. Yoga, if you say, it is really a boon for especially the working population of our country. With spending an entire day at your workplace full of stress, that is something which can just calm you down, which can relieve you of your stress. The alternative medicines, we now don't want to bombard our bodies with all the pharmaceutical components in the body. So, identifying something that is missing or that something needs to be fulfilled in their body with the small plant supplements or the basics of which our ancient people used to use is going to be welcome soon now, and the use of these medicines has actually started now. So I feel that we would start respecting our ancient culture soon.
Yeah. And as COVID was very new for all of us, we were not aware that what COVID exactly is. So, what was your reaction to it when you came to know that COVID is something which is very harmful and all that?
Yes, it was scary indeed, dear. In March, when I decided that okay, I will take charge as the nodal officer for COVID-19, I knew I'm asthmatic myself, so I was at risk. But still, I thought that no, I have to accept it. See, someone had to do it because when we take the Hippocrates oath, we accepted that yes, we are going to stand uh, when an enemy attacks, in the form of a disease on us. And COVID was an enemy जिसके बारे में हमें कुछ भी नहीं पता था. It was an enemy which was not known to anybody of us. It was scary. But then somewhere that inner strength or the belief that yes, if I am going to work for the society, for the humanity, my patients are going to need me. The all the needy people for whom I have been working, their blessings are going to count. That feeling gave me strength or motivation to keep on working for COVID. And slowly, slowly, as days passed on, after say getting used to those month 2 months COVID times, the morale started boosting. Somehow I started feeling a little more secure. The fright of the disease went off. Is the fear of contacting the disease during this entire time always used to be there at the back of the mind. But at the same time, a thought used to come, no, there is somebody or someone who is going to protect you, because people need you, people need your service.
yeah,
And plus, somewhere, even if you're working in COVID or you're around in the society, uh, the following of the COVID measures which we talk about, like the SMS that I call it, the social distancing, masking yourself, using the mask, and sanitizing yourself liberally. These three things, which till date I have never taken my guards off. So it is like following this religiously has really been very important during this entire period. So even if like you're working in with the patients or you're working amidst the public, if you are following all these and at the same time people around you are also following this, you are protected. Because till today, now fine, we have got ourselves inoculated or vaccinated, but till today these few measures have been the vaccine for me or for the n number of doctors who have been working in COVID. So, if we are following, I feel that if you are following these measures, somewhere the chances of getting COVID or getting ill by this disease are pretty less. So, that is one thing that you really have to follow now in the COVID era or after COVID as well. Because COVID, we have to live with COVID. A new normal has to be adopted somewhere. So
yeah,
that is what has been important in the last few months for me.
yeah. As many of them came to know that now we are getting vaccines and all that. So many of them have started taking COVID as very lightly, like they don't wear masks, no social distancing is followed. So lastly, we would like to tell our audience what safety measures and care should be taken as of now.
See, vaccine is not going to provide you lifelong immunity. So we have to, as I said, that we have to adopt to a new normal now. During the COVID times, we all must have observed that in the countries which were actually following the COVID norms in the pre COVID era, who had a routine or a ritual of wearing a mask, who had a ritual of being socially distant away from each other, like in countries like Japan and all, the intensity of the disease was pretty less. So, somewhere now we have to realize this and we have to adopt and we have to start living with this. We have to replace the handshake with a namaste. We have to follow the social distancing. We have to do this. We have to wear mask, be it wherever or whatever we are doing. Wearing of mask uh, is going to be the practice for near future. Hand hygiene, basically very important. Fine, if you have come in contact with a COVID patient or any other infectious disease patient for that matter, till you give the entry to the virus in your body, it is not going to show the illness in you. And the most important entry point of any disease or any virus in your body are your hands. So following the hand hygiene is going to be of very important. You touch an infected surface, wash your hands, you won't be affected. So washing your hands using sanitizer liberally is going to be your long term vaccine, I would say. Now, for some time, forget the short messaging service and adopt this new SMS style in your life, I will say. Along with that, work more towards building your immunity. Have healthy food. Practice a little exercise every day. Have a stress free life. Because COVID is what, or any infectious disease for that matter, is something which attacks your immunity. So, we have to build up our immunity. So, having nutritious food, having ample of water, having learn at least 4 times a week a mild exercise. So, all these measures are going to be helpful for us in near future, especially
Yeah,
for you young kids.
yeah. Sorry, ma'am, as I'm not professional, this is my first experience to take the interview. And thank you so much for joining the meet and all the best for your further success.
Yeah, thank you, Shraddha, and I would like to congratulate the entire team of Udyojak for all their new endeavors. Just keep it up, dear children. You are the future of this country, and we as Indians really look forward to you. So, all the best, and thank you for giving me this opportunity. Thank you, everybody. Thank you.